Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on the tenuous state of relations between the premiers of Alberta and BC. But first, the role of the medical community.
Our hearts go out to the family, and you know, nobody wants to ever see this type of thing, especially because it is preventable.
There, the new president of the Alberta Medical Association addressing the recent death of a baby born prematurely due to congenital measles, urging more people to get vaccinated. According to the province, contracting measles while pregnant can increase the mother's risk of death tenfold and lead to complications for the infant. Joining us now, Dr. Shelley Duggan, a critical care specialist and outgoing president of the Alberta Medical Association. Dr. Duggan, good to see you. Welcome back.
Thank you.
Well, and now before we reflect on your 12-month term, let's maybe first touch on the measles outbreak of the past several months. Now that there has been a death, how does that change the conversation around how this outbreak is being managed?
Yeah, I think it really confirms what we've been saying all along, which is that this is not just a simple infection, that it isn't an infection that we should just let children have and then they'll be immune and we can all go about our business. You know, I think people now understand why we've been so concerned about low immunization rates, because we had a child die from a fully preventable disease. And so we've got to step things up and we've got to make sure that we get those immunization rates back up.
Where does this measles outbreak rank on the list of priority issues you found yourself contending with as AMA president?
I think it's a huge priority for us because public health has really not, it's certainly not strong in Alberta. You know, we don't have a CMOH yet, or at least a permanent one. You know, we have a skeleton staff of medical officers of health, and we can see that this is what happens when you don't have a really strong public health arm. And I, direct you to the article that was published in the Edmonton Journal today about restaurant inspections. You know, this is what happens when you don't have a strong public health arm in your province. And we are going to see more and more issues arise because of it.
Now, this is a time of change within Alberta's healthcare system. As AMA president, what kind of window were you afforded into all that is happening within the system-wide overhaul?
Yeah, I can only call it chaos. You know, we've seen a system that was quite well integrated, albeit not perfect, but very well integrated, be completely dismantled. And now we have a system that nobody really knows how to maneuver. You know, we have 4 pillars, we have 4 health ministers now, we have organizations, we have numerous CEOs and CMOs. And what the front line is seeing is that there's no integration. And we really don't know how things are going to work going forward. So the chaos continues.
New mandate letters were issued today to those 4 ministers overseeing health delivery you mentioned a moment ago. In the Premier's words, they have been tasked with driving a new era of healthcare that puts patients first, strengthens preventative care, improves access in rural, urban, and Indigenous communities alike, and reduces wait times. What degree of confidence does that give you in governance and leadership of an overhauled health system moving forward?
Sadly, very little confidence. You know, I would certainly say that it would be nice not to need 4 mandate letters, that we really should only have 1 health minister and 1 mandate letter. And what we are seeing, for instance, is a disconnect, if we take 2 of the pillars, between acute care and assisted living Alberta, where we now have 2 organizations that are going to have different metrics and, that are heavily rely on one another. And so far, we have not seen that happen. We have ALC numbers, particularly in the Edmonton zone, that are enormous. And it's not clear how this system is going to make that better. And so I would suggest to you that having 4 mandate letters is probably not necessary if we had an integrated healthcare system.
Speaking of letters, in your final letter to AMA members, you highlighted high points. How has the landscape changed for the better where Alberta doctors are concerned?
I think we've made significant improvements in how family doctors are remunerated, and we're hearing from our colleagues across the province that things are so much better. So I think we've taken a really good stab now at trying to not only stabilize those practices but help them grow and to attract young doctors to become family doctors. And I think we've made some significant strides on working on acute care as well, but we have a long ways to go. I would say that the Alberta Medical Association does appreciate working with Minister LaGrange, and that, I certainly had a good relationship with her. And hopefully we can keep that going, because it's the only way we can make things better.
All right, one final question for you. What now rests on the shoulders of Dr. Brian Wurzba, who we heard in the clip off the top, as he takes the reins over from you as incoming president?
I think Dr. Wurzba has a significant mandate in trying to really get people to understand why we need integration and to try and figure out how we're going to get that. So we have an integration council that exists at the highest level between ministers and deputy ministers. But we have no way of making sure that the front line can get patients to move seamlessly through all the pillars in the different organizations. So that's something he's got to take that ball and continue running with it. And of course, we have negotiations coming up in this fiscal year as well.
That was Dr. Shelley Duggan, a critical care specialist and outgoing president of the Alberta Medical Association.